So, welcome everybody, and thanks for joining us today. I'm Lori Schellenberg, and I'm the founder of Stepping Stone Nurse Academy. If you're here today, you're likely a nurse exploring non-traditional roles or career options. And workers' comp case management is a role that many nurses hear about, but they really wonder what it's all about. They don't really understand it. It's kind of I always say it's a beast unto its own if you're looking at workers' comp case management. Today's panel was created to help you understand what this role looks like and how nurses build careers in this space. Thanks for being here. Our moderator and one of our panelists for tonight's discussion is Anne Llewellyn, and she'll be steering the ship tonight. And what we'll start out, she'll be starting out by introducing the panelists. And Anne, can you start us off by sharing some information about your background in case management and as a past president of CMSA and as a well seasoned workers' comp nurse case manager?
Sure,
How have you seen case management grow as a specialty through the years?
sure. Thank you. And thanks for everyone for coming on today. And we're looking forward to some good discussion to help, as we said, nurses to understand this role in workers' comp as a case manager. So I started my career in 1988. And after being a critical care nurse, I was a risk manager for a while. And got into case management when I moved to Florida. So that's where I started. And I was a catastrophic case manager. So we dealt with spinal cord injuries, head injuries, all different complex conditions. AIDS was really busy at that time. So we took care of a lot of AIDS patients, especially, before the medications were developed. So we had really sick patients. But it was a great time and a good role for nurses to be, especially as advocates for people, because it was a very contentious time. A lot of gay men were getting HIV and AIDS, and they were really feeling pressured. A lot of young people, so they couldn't work, and they really needed some of their insurances because they stopped working. The insurance stopped. So they would have to, borrow money from their life insurance policy to be able to get medications or to, take care of some of the medical conditions that they had. And it was really a difficult time. But we also learned a lot during that period about case management, about advocacy. So it was an interesting time for us all to come with. So next I want to turn, because she was my counterpart at Intracore, Anna Banash.
Hi, my name's Anna Benach. I've been working in case management for almost 40 years. My son is 39, so yeah, almost 40 years,
Yes.
or around 39 years. And like Anne said, we worked together. I was brought on by Cigna, which is Intracore, who had both group health and did work comp, because I was working on an AIDS study at the University of Miami at the time. And then I would dabble in work comp and I would dabble in group health and etc. And then from there on, I was picked up by Marriott Corporation International, the hotel company, where they were developing their own in-house telephonic case management program. Florida was the third state that was opened to the telephonic case management program. And currently manage a team of nurses. I do have my hands in the field. I have a couple of claims in Dade County and Florida and Miami, just to stay connected with the field because it helps me get a temperature of the healthcare culture and what's new, what new toy are the doctors bringing into surgery or recommending. And also I do training and reviewing complex cases. And then I think
So, Anna, from your perspective, what is the basic role of the nurse in workers' comp?
in workers' comp, I took I think one of our one of the greatest trait of a nurse is she knows how to identify a good medical provider. How, physicians that are have good surgical technique, physicians that understand the body, that is not just a physical, you have to also treat them a psychosocial aspect of nursing or of medicine. And so it's important to know your medical community where you work. It's important to identify the ones that aren't so good. It's important to know what facilities provide what. Not all facilities have ventilators. So you get a 24-hour, you need a patient with a 24-hour ventilator, you need to identify what facility will take them, the insurance will cover it, et cetera. And then also, I think we help guide patients or injured workers or illness through this web of healthcare system and making sure they follow up, that they're compliant with their care, so to prevent delay of recovery and to reduce cost. The longer they stay in the system, the more costlier the claim becomes, or the case becomes, or the patient becomes. And also get them back to functional status. There's nothing more beautiful than somebody going back to work, to their full-time job, be it whatever it is, and feeling good and feeling healed. And so that's, I think, our focus.
For sure, for sure. Dr. Ralph, would you like to bring your perspective?
Yeah, sure. I'm an orthopedic surgeon, been doing orthopedics for 37, 38 years, primarily in trauma and joint replacement. In my early part of my career, I avoided workers' comp like a plague. Um, and I think in part that was due to the fact that there were not nurse case managers around. You felt like you were going through a system and you didn't really understand, because workers' comp, it's not just clinical care. It's clinical care, plus you have the legal part of it, plus you have the economic part of it, which as physicians, especially orthopedic surgeons, I'll tell you, you see a problem, you solve the problem. How the problem happened, who's the responsibility, not my problem. But in workers' comp, it's different. One of the challenges I now face is doing independent medical exams is the initial evaluations mention nothing about mechanism of injury, nothing about what went on. And so you're digging yourself out of a hole from the very beginning. So it is a complex system. It's a system, but it's a real opportunity for nurses and nurse case managers to get involved early and really have an impact on the system. And you will find that if you're there with a physician who you have a good relationship with, it really makes his life better. It'll make your life better. It'll make the injured person's life better. So it's a really good opportunity for nurses with a little bit of clinical experience and a whole lot of common sense.
For sure. Thank you for that perspective. Before I bring in Chelsea, I want to, Jane Ann Eastman joined us. And so welcome, Jean Ann. We're just going around and introducing the faculty, and then we're going to come and introduce the participants so we can know who you are and what you're looking for. So thanks for coming on. Chelsea?
Hey, my name's Chelsea, and I'm in Tennessee. I've been in the work comp space for about almost 14 years. I started as a case manager and then oversaw, hired nurses for since then. I have my own case management company now, but I really focus on hiring, training, and mentoring nurses, especially ones who want to either leave the bedside, or maybe they're even in case management in the hospital role or another, something similar, but they're wanting to transition into the work comp space. Even though we are case management, it still looks quite a bit different. And as Anne, Lori, and others have said, we do guide the patient, through a very complex web, and we do rely heavily on our providers, such as Dr. Ralph. And we're only as good as our providers, a good provider, but also we guide each other. Workers' comp is a very small community. It seems quite big if you're on the outside, but it's really quite small. And we rely heavily on our network of vendor partners. And that sounds like a foreign concept, but it's, people who help us get interpreters for our patients or uh, a ride to the doctor, things like that. We rely heavily on those people, and we rely on each other, people we don't even work with, but they're just, coworkers. So it's a very unique way to keep up your skills because you're expected to stay on the forefront of all the new clinical um, things going on, all the developments, but you're hands off of the patient. So I always say that if that's for you, if you're okay with being, hands off of patients going forward, but you still want to keep your clinical skills sharp, I think it's a great opportunity.
Good. Thank you, Chelsea. Let's Jane Ann, do you want to introduce yourself and tell us where you're from? Can I mute?
Let's see. Oh, hello.
Hi. Where are you from?
My Northeastern Pennsylvania, and I work in occupational medicine as a nurse practitioner. Um, the lighting is so weird in here. Um, and I really enjoy the case management portion, what I'm exposed to. I'm not a case manager. I see the patients for their initial comps, their evaluations, and their, that first intake, and then we follow them up to refer them to willing specialties. That's very difficult, as Dr. Ralph mentioned. Getting providers to take our fractures and repairs and things like that. In general, because of the things he mentioned, it's frustrating, but I understand that it's a complexity that providers sometimes aren't willing to take on. So, with that said, I'm interested in learning more about the case management end of things. Um, I I enjoy uh, being resourceful and the resourceful end of things. Matching people up with what they need, navigating, trying to help uh, the patient navigate and the company navigate, and trying to find what's appropriate for restrictions and how we learn to decide restrictions and what people need. So I'm interested. Um,
Thank you for bringing, I'm glad you were able to join us tonight. Thank you. Marianne, tell us where you come from and what you're doing these days.
Um, I am a retired catastrophic nurse from the Bureau of Workers' Comp in the state of Ohio. I did 33 years of basically all the catastrophic claims for the state of Ohio, no matter which end they might have come from, and also across the United States, because a lot of them are traveling inbound. And so for me, it is a culmination of all my nursing skills. I had altogether, I've done 49 years of nursing. And so 33 of those was in workers' comp alone. And it was a great rewarding field to be anybody to want to go into, because there you're using and you're learning a lot of skill sets. You're learning to work with a lot of variety of folks, whether it be from the nursing aspect, hospitals. You'll get a wide variety of folks that will become your comrades, so to speak. That's how I met Anne, and through Case Management Society of America. And it's just led to all kinds of stuff. So even though I've been retired for now, about 4 years now, I still am heavily involved. I'm just getting a lot of phone calls. A lot of people always want to utilize my skill set. And actually, I'm working with a colleague who's the national president right now, and we are writing a book about workers' comp. So, you're you're never really gonna once a workers' comp nurse, I think you're always gonna have it in your heart, and you're always. I think nursing alone, as I had spoke with Anne earlier about, you're always an advocate, not just for yourself, but you're also going to learn to be an advocate for so many people, and those people are going to refer other people to you, and it just becomes a great big community, and it's very rewarding all the way around.
Great. Thanks for coming on, Marianne.
Ain't
Um,
that a problem?
Dr. Ralph, do you feel in your experience when you had a nurse case manager, do you feel like some of the red tape was decreased? Like you really could do your work as a surgeon, and the case manager would help you?
You could probably ask Lori that question because she was really involved in that when we first started. It's like you have somebody in there who says, this is really not as bad as you think it is, that I can hold your hand, I can show you how to work through the system, and I can make this enjoyable for you. And once you have that, it changes your whole perspective on things. It's as a physician, we try to see every patient as a person. But sometimes when with workers' comp, we saw somebody as being an injured person, not a real person. And once you're able to get rid of all the red tape and the issues that are resolved, you can go back to treating them as if they're any other patient, just like somebody who off the street who fell out in their driveway while playing with their kids. Um, so it makes a huge impact with the right person, and developing those relationships take time, and you have to work, it has to work on both sides, but once it does, it's a really sweet spot and works well for everybody.
And I think from the nursing perspective, case management perspective, it works for us to establish those relationships with the physicians. Dr. Ralph and I, like he said, he really didn't want to manage or deal with workers' comp. And I'm like, look, it's really not that complicated. You can do this, and you can you can do independent medical exams when you retire. But I mean, it's true. It's very true that symbiotic, that working relationship. And as Chelsea said too, and Anna said, knowing your providers is three-quarters of the battle. If you've got somebody that trusts you, the provider trusts you, they know you're going to bring them a job description. They're going to know what's available as work, return to work options or transitional care, and all these terms, Victoria and Janine, you'll learn about. We're kind of throwing them up out there to you, but they're all part of the role and what you do. And so you see that it is more of a working relationship between the physician or the provider and the nurse case manager. It really is. And also the employer, which is part of this whole crazy workers' comp thing. It's three parties. It's the employer and the provider, the injured worker, all of us working together as a team, which makes it very, very unique. And I'm sure Anne's going to be asking more questions about that, but it seemed appropriate to bring that up.
Yeah. Well, that's one thing I think for maybe some of the people who really haven't been in workers' comp yet, but to let them know that really the workers' comp insurance starts on the day the person's hired at their job, and it covers them for anything that happens to them if they get injured or ill on the job. So I heard one Dr. Mealy Anna one time said, workers' comp insurance is like golden because people get the care they need and there's no cost to the employee. There's no deductibles. There's no out-of-pocket costs. They get to go and they get to, hopefully with what Lori and Anna and everyone's saying, to the best providers to take care of them so they can heal and get back to work. So knowing your providers in your network or wherever your patients are coming from, to go to those centers of excellence, to go to the doctors who have great reputations, if they take workers' comp. Some doctors don't take workers' comp. And that can be an issue if you get a lot of good doctors who don't take workers' comp. But that's where the case manager, as Dr. Ralph said, can be that person who really helps the physician know the rules. We need this form filled out every time we come here. I'll bring it with me. You can fill it out and I'll take it with me and get it back to the adjuster. So, I mean, I think knowing the rules, working together, helping the doctor do his work, and you're the one who knows the rules and the process really helps the physician cut down on some of the paperwork or, different challenges that they face. But Anna and Chelsea, I wanted to ask you both this, and I think you're looking at it from different perspectives sometimes, but how is success measured differently in workers' comp compared to bedside or clinical nursing roles? Anna, you want to go first?
Okay, so I think success is measured when can you can get this patient through good, excellent medical care to return to their pre-morbid state, to the state they were before they were injured. Success, sometimes they can't get there. Sometimes they're permanently injured. And it's accepting this new person that they are and utilizing all the resources that the community has to offer plus with different physicians that assist them, like a spinal cord injury patient. I mean, that is a lifestyle change. And so what's success there? Making sure they've got the best physicians covering them, that they have good home health, because of the golden ticket of the workers' comp insurance, they get covered for everything, 24-hour care, wheelchair, vans, everything. So therefore, that success is getting all these parts to work and without a problem, and then staying on top of when issues do come up. The other thing is, I would say, is that and this is measured by insurance companies, which is we prevent litigation. How do we prevent litigation? By making sure that the injured worker is getting everything they need medically and socially, but yet sometimes that's not what where their goal is. There are what they call secondary gains, which is, yeah, I got injured, you're giving me all this great stuff, but you know what? I can move over to the next hotel company and make 10 cents more an hour, and I'm going to go and just get a nice settlement from this. So everybody's got different goals. If you've got it, and it depends. The other thing I wanted to say is, who is your client? Who is your client? Sometimes it's the patient, sometimes it's the adjuster, and sometimes it's the employer. It depends where you're at or where the goals are for everybody there.
Great.
So you can feel that you're being adversarial, but you're not. You really are. You're always helping some part of the healthcare system when a nurse is involved in case management.
And, an injured worker could get an attorney just for something very simple, like their wages weren't paid, their checks didn't get deposited. Because when a person is injured on work and they can't work, they still are paid under workers' comp. It's a lesser amount of money than their average paycheck every week, but again, it helps them pay the bills. But if the claims adjuster, who is really a very central person in workers' comp, doesn't put her paperwork in to make sure her claimants get paid, they can miss a week. And if you miss a paycheck, how difficult that is for you. So they get upset and they say, I can't take this. I want to call an attorney. There's been some stats that show adding an attorney to a workers' comp case adds like 40% to the cost of the claim. So our role, as I think, I want Chelsea to give her perspective, but our role is really, and Anna, you said it, for cost savings, to keep the claim as cost effective as possible, even with doing everything for the patient, with giving them the needed equipment. We're not, but we're going to make sure they need it. they could want it, but do they need it? And that's where we have to have that good relationship with the doctor to write that order and write that rationale for why they need something. So the case manager really, I think in workers' comp, it's really the most holistic role that case managers play in the whole system. Because you are dealing with, as Anna said, the employer, the adjuster, the injured worker, the physician, getting that person what they need, getting them, if they can go back to light duty, to getting them into a position within their job or even another job that they can get back to work. So Chelsea, give us your perspective on this. How are you seeing like a nurse who comes in, how do you educate them and part of your mentoring to really understand their role?
Yeah, well, if they're coming in from the bedside, I think you asked how is success measured differently. I started out very first job in CVICU, and my job was to get them through the next 12 hours. You know, like they just needed to survive. And if you're working at the bedside, that's your only job. You're going to get a glowing review if, not saying every patient's going to survive, obviously, if you're working in ICU, but it's to do no harm, right? To do no harm, to do your very best job, to show up for work, right? Like you have the most basic goals, right? Because you're working in a factory of healthcare, if you will. When you transition to case management, you're in for the long game. You're going to have some of these patients for a month, maybe, if it's just a short goal that you have, but some of them you're going to have for a year. Some, if you're doing a catastrophic claim, it could even be up to 1.5, 2 years. So you're really developing a long-term goal of returning them to work as quickly as possible, yes, but also as safely as possible. And then, like Anne said, also using your clinical knowledge to keep all of the wheels turning, to do everything as quickly and efficiently as possible, but also the ultimate goal is saving money for ultimately the employer, right? Like, because it's their policy. So ultimately, you're saving everyone money to. And I can give you an example. Today, I had a provider write an order. She just threw out, I want this specific type of ankle brace. I knew what she meant. She said the wrong thing. And so we were headed down the hall to have a custom, very expensive brace to be made at Vanderbilt Orthotics. And I said, I don't think that's what she meant. I know she actually meant like the $20 brace at Walgreens. And they said, but that's not what she wrote. So this is what we're going to do. And I'm like, no, we're not. Let's go back and verify. And sure enough, we needed the $20 brace. But if no case manager would have been there, we would have been an easy $1,500 down the road. Those are the types of things that we have to step in and question. And they're so small, but they make all the difference, right? They make a huge difference. I mean, it sounds, it's just a huge difference. Your goals are different. Your relationships are different. When your patients leave you from the bedside, you often don't see them. You don't know if they got better. You don't know if they did all the things that you gave them at discharge. Here, you kind of see that end goal for the most part.
So Chelsea, with that really good explanation, what do you think most of the competencies that a nurse, if she is coming from the bedside, needs to be successful in workers' comp?
Well, I do like to see some experience. I have hired people straight from the bedside, but I have also hired some that have some other experiences like home health or some traveling, because we do a lot of traveling, on the road, and they need to understand that if they're going to do field work, and most of the time there are two main types, I should say, of case management, and that is field and telephonic. And most of the time, I would say, and Anna, you can back me up on this, but I would say most of the time you do field before you do telephonic. And so I would say you need to be comfortable with driving. Flexibility is number one, because things change on a dime. I could be headed to an appointment and all of a sudden that appointment's been canceled. And so I have to pivot, you know, um, flexibility, time management, um, again, comfortable with driving and driving often, minimal, I would say a couple of hours a day. Um, and just understanding this is never an 8 to 5 job. Many companies will tell you this is an 8 to 5. It is never an 8 to 5 job. At most, it's you know, I would just plan for 6 to 10. And the great thing, it's flexible. So some days I work 3 days a week, and then other days I work all 5. You never know. But if you love it, you'll never do anything else.
Anna,
So
you want to add anything to the competencies that you look for when you hire some? And Anna and Chelsea both do hire case managers, so I thought this would be really a good for the people that might be looking to get into it. What skills should you really talk about when you interview with it? But Anna, go ahead.
So, I really think that nurses, even on the floor or in ICU, they're doing case management from the moment they start working because you are involved with this a hysterectomy. Let's say we used to have hysterectomies that came inpatient, but we used to, who are they going home with? What are they doing? Do they have help at home? Even at discharge, we're already doing case management. So it's a natural trait that we carry over, but this is in the field. So what helps us? Being curious. I mean, if you've never had a spinal cord injury, look it up. Google it. Now it's easy. Now you can just go on the computer and research. What do you anticipate? What are the care needs? If you've I had a patient with an illness called ciguatera, which is very rare, and it's eating fish that eat coral, that eat off the coral, and it's a type of infection that affects your nervous system, and it's really horrible. And it took me 3 specialists to get them to the right one. And so I had to research it. I didn't even know what that was. So that's you have to have a curious mind and willing to learn and being flexible, like Chelsea just explained. But when I interview for nurses, I look for experience. Where have you worked? And I have hired nurses that have worked everywhere in ICU or in ER or in the I once hired a nurse that worked only 2 years in hospital bedside general med surg floor, and she was fantastic. So I think it's just falling in love with case management, like Chelsea said. And you will carry that skill and stay curious. Stay curious about medicine.
One thing I would say too, especially for field case managers, to be able to go, especially I know when I started and spinal cord injuries, head injuries, we had, many really complex just fractures, compound fractures, going to rehab with people, going to the rehab. Now they used to, when I was a case manager, we used to go to our injured workers, rehab meetings where they would have staff meetings. They would have every specialty give insight into what they were doing with that patient. Speech therapy, cognitive therapy, PT, the psychologist would be there. And that's where you really learn. And Anna, as you said, be curious because that's where you learn why somebody with a traumatic brain injury is exhibiting this kind of behavior. And you get to ask the therapist, what's the long-term effects of this? And what kind of work could they do, if any, to go back to work?
Yeah.
And so understanding all that information, you become very valuable to the adjuster and to the employer because you can then talk to the physician. Maybe we want to get them into this kind of work. It might be, just something very simple for them to go back to. If an employer has a job, just to get them reacclimated into society after having some type of a traumatic brain injury. And then also getting them into good therapy places too, so they get the best care that they need. I wanted to bring Dr. Ralph in to see what are your traits that you've really appreciated in a case manager when they work with you with a patient.
Well, I think the first thing that I look for is, especially if they're coming in with the injured worker at the same time, I look for their relationship with the injured worker themselves. It gives me a sense of where I'm headed with this. Do they have a good working relationship? Is this the first time they've met? Is there some tension between them? That sort of sets the tone about what we're doing. The other big thing. So that's number one. The second thing really is then as the interaction goes on, the case manager has to basically blend into the background, let the encounter occur as it would naturally, so that this is not working with an injured worker, it's working with a patient, just like every other patient. And then you bring it back in at the very end. And then that's when the case manager becomes the problem solver. Here's what we need. I don't know where they're going to authorize this. I don't know where you're going to get this. Here's what we need to get. And that's where they become the problem solver. And that's what makes things that for me, that's what made things very easy. And it can make things easier for any physician if you allow things to happen in that order.
That's so true. I remember one time with a patient that I was with an injured worker and the doctor was going to order some tests. And usually we're trying to expedite this, like to get them, if it test, they wanted to do a test. And the doctor said, I'll see him in 4 weeks. I said, can't we bring him in sooner? She goes, well, will you be able to get the test done? I said, oh yeah, I'll be able to get that MRI scheduled for tomorrow. So I could get the patient back that same week and the physician could see the results of the MRI so he could further direct treatment. So we try to expedite things.
That's a very important point because you talked before about, involvement of attorneys. Why does that become almost sometimes almost a necessity? Is because approvals, there's delays in treatment and it frustrates the worker and they don't see any other option. They say, well, I'm going to get an attorney. My friend got an attorney. They don't understand also that once an attorney's involved, no one talks to them again. That's the big misconception. So really, you'd be able to expedite things like that has a dramatic effect on the overall outcome, the relationship with the injured worker, and obviously your relationship with the physician, which you're also trying to build at the same time.
For sure, for
I
sure.
think, I think, can I say something here
Yeah,
too?
I was just gonna ask you if you wanted to add anything.
Yes, what I wanted to say, speaking to the nurses, to Victoria and to Janine, when you hear the word attorney, I know the first time I started hearing the word attorney and that I might have to go to a hearing and be a witness as a workers' comp case manager, it really, I was like, because in the bedside nursing role and in that world, if you hear the word attorney, as a staff nurse or that you're going to be involved in that, that's very, very like that is not something that is normal, like normal. But in the workers' comp arena, as you all can attest, like it's part of the process. Not that we want them to have an attorney, but definitely, it is more of a part of the process. Would you all agree?
Yeah, yeah, for sure.
Yeah.
Um, I want to ask this question for Anna and Chelsea again, because you do hire people. But what is what is return to work with such a central goal? Why is return to work such a central goal? And how does the nurse case manager influence this outcome? Chelsea, you want to go first?
Yeah. Well, I mean, that's return to work is we have to have a goal in place. If not, I mean, all the research that we have shows that if they're sitting at home, if they're not on some sort of trajectory or even working modified duty, and I'm using a lot of language here that if you're not working within it, it may be a little foreign. But that the claim will tend to drag on more or less. But it's so important because number one, it keeps the cost down, but our overall goal, right, is to return them back to their normal life. Um, so our entire focus is to return them their physical health. We're nurses, right? He's Dr. Ralph's a physician. Our goal is to return them back to their as best as possible uh, prior injury capabilities. That's not always possible. Sometimes it's just not. Sometimes they are just a little shy of where they were before having a surgery or some catastrophic injury. However, our entire focus during the course of the claim is always to return them to work. Sometimes you're going to have it. We have injured workers who, for some reason in their mind, they're never going back to work. I just can't go back to work. I'll never be able to go back to work. But we always have to stay that focus, even if at the very end, the determination is made. You know what? You can't go back to being a, dump truck driver, or you can't go back to being a welder. However, you can go back to being you know, um, a safety supervisor within the same organization. So there are other roles that you can play within workers' comp that help people find job opportunities within their same space, that they educationally appropriate roles for them, and that's a whole other job capability that you could look at. But our focus is always returning them to work, keeping that focus, keeping them aligned to goals. Because when we do that, their health and their recovery, if they're in physical therapy, that all aligns and keeps them moving along.
Right. And Anna?
So, yes, we influence the whole process of return to work. We especially teach employers how to identify transitional or modified duty. So if you have a one hand only um, uh, what is it, ability to work. One hand is injured, the other one is not. So we put them sorting silverware, or we have them taking towels to a room, or just different tasks that can be performed. And doesn't require them to be either standing or sitting too long, etc. Or we do ergonomic evaluations where if they have permanency, how can we modify or accommodate them in their work environment by switching the height of a table or a chair or a tool to make their work easier and prevent further injury. So nurses do that. They're able to identify areas where we can modify a role so that they can continue to work. Plus, it's good for their psyche. I mean, it's not good for them. It's not good for any of us to sit home and watch TV all day, even when we retire. So
Yeah.
it's good to move and see people, and we live longer if we do this, even after retirement. So
Great.
And I was going to add a little bit more to that is that
Sure.
within the state of Ohio, what's also helps assist a person, let's just say that they can't return to their pre-normal work condition, that where they were, and if you can't find anything within the company to accommodate them, we also did, their salaries are offset in our state. So therefore, that helps a lot in the person's recovery status, also working with the physician and the attorneys all know that too, is that there's always that. So I always worked very closely with the claims representative that was assigned that person's case so that we could all work together towards trying to have that monetary issue not become such a black cloud on their life, because many of these people, their whole family relies on them, or it's not just their immediate. Sometimes they have parents and stuff of that nature too. But that's one nice thing in our state.
That's great. That's really a good thing. Now, I think Mary Ann brought up a good thing where she said in Ohio. Anna works in an international company. So she has workers' comp people all over the country, actually the world. So Anna, kind of explain about the different rules and laws by state and how a case manager is trained to understand that.
Yeah, so um, with the compact license, which we're very fortunate in most states to have that access, our nurses cover multiple states. Some of depending on the volume of the state. Florida is a state that's very heavy in work comp, and therefore we have two nurses in the state of Florida. But the nurse in Tennessee, or yeah, she covers Tennessee, North Carolina, South Carolina, and Georgia. And each of those states have different regs and rules. Some states have panels. Some states, like California, has a managed care arrangement where they have a managed care program fully managed by the self-insured company and by us. We're self-insured, and so they have to pick a doctor from the list, just like an HMO. Ohio has C9s and all these different, they require a nurse to sign off on orders that are given by a doctor. And there's just little nuances in each state that is different. And so when you work multiple states, we have a nurse in Illinois she works 11 states. But, we may get one case from Wisconsin a year, 10 from Kansas. So there's little tidbits, and she knows them. She knows them. So
Don't they you get cheat sheets like for your
yes,
things
we
that
have
you,
cheat sheets of one of them is, are there any case management regs? Not a lot of states have case management regs.
like
So
you have to be licensed in that state or be in a compact or, yeah.
yeah, exactly. And the other thing is oh boy, what else was I going to tell you? So I mean, there's just a lot of different little nuances that each state has, and we do have a state. Oh, the other thing that I was going to tell you is it a pay without prejudice state? That means that we can authorize treatment from the very beginning. If it's not a pay without prejudice state, you have to wait till compensability has been determined. That nurse cannot contact that injured worker until the adjuster has determined compensability.
And what
Um,
does compensability mean? I was going
compens-
to mention just before you describe it, we're using a lot of terminology that are workers' comp language. So that's another thing that's different from group health or the traditional medicine. Compensability, return to work, accommodations. All those terms are terms that you would learn as a case manager in workers' comp because they directly impact your job. So
So compensability means that the adjuster determines whether this specific injury or illness is directly related to the work that the person performs, or were they at work when it happened and something went wrong. Like a pipe went off and hit the person, that kind of thing. So it has to be determined that it is compensable before.
versus like somebody who's cleaning their gutters on a Saturday afternoon at their house, they fall off the ladder and they maybe they don't even have health insurance, so they don't go to the doctor. They wait till they get to work to say, I hurt my back. And then they have to show how they hurt their back at work. And if if the adjuster can't join those things together, that's compensability that this was a work injury. They could deny the claim. So it's important that injuries are identified early, they're reported to the whatever the source is that the employer has set up because we want to make sure that it is a workers' comp injury. Chelsea, anything you want to say on that?
I just want to say that these are a lot of, we're getting in a little deep on things that, I know you're like, I'm not even sure about this, Victoria. You're like, I don't even know if I want to tackle all of this. But don't get too worried about all of these things. Wherever you land, if you decide this is for you, these are things that I tell every new nurse, give it 6 months. Like it's not just learning a new um, job, it's learning a new career. It's a whole new career path. And there's, every company has their own training program. Certainly, Miss Ann and Lori have put together their own special one. But if you decide to work for any of the wonderful companies out there, they'll train you on all of these things. So it can be very overwhelming learning about compensability and different state laws and all of that. But don't, you would only be responsible for your state or the states that you work, depending on how close you are to another state.
And you
So
always,
don't
and
let
you
all that
always,
overwhelm you. I just wanted to say that.
and you always have a manager, somebody to ask questions. So it's not like you're out there on your own.
Yeah.
You have somebody to work with. I wanted Jane Ann wrote something in the chat about depositions seem more common and less scary in Ahmed than in any other environment. So Jane Ann, what would you like to say about that? Maybe explain that for people who, well, why would I go to a deposition?
So I haven't gone to one myself. Actually, I was called to do one, but it was canceled before I got there. But I mean, I literally was probably developing an ulcer thinking about this. And my my medical boss says, "Why?" She said, "Do you want me just to sit in with you? Like, would that help you feel better about this?" I said, "Well, yeah." So basically, my colleagues said, you're going to do it. You're going to have that happen. Relax. You literally just pull up your chart for the said case and answer their questions very simply. And, we can go through it before you go into the meeting, which is virtual now for ours, it seems lately. Um, and it's very simple. It doesn't feel like, I was in a school system before, I was in a hospital system. Um, when there's a lawyer involved, I mean, it's very stressful. You know, I am not the I am not the subject in trouble here when you're called to come before a deposition. Basically, you just need to help fill in the gaps. You need to provide some information, what you saw, what you documented, rely on your documentation. But it really doesn't seem, it's just not the same. It's a different environment. And
Yeah, I can speak to that a little bit.
Go ahead.
So I've done hundreds of depositions. It is the easiest thing you can do in your life. If you chart well, you're all they're trying to do is to get your information into the formal record of the court or
Mhm.
the jury. That's it. Stick to your record. It's easy. And I've never seen, actually, never been in a case where a case manager has been called in to testify. I mean,
Oh,
their data might be, but
just
not the case
providers,
manager. Huh?
just providers.
Just providers.
Okay,
It doesn't happen. I've never seen it. And I've done this for, 20 years.
okay.
So
Yeah,
it's a
well,
safe place to be. You are involved in the legal environment, but if you do your charting well, even that's why I look at when I'm doing my depositions. If I've done my exam well, if I've done things, there's always going to be holes and gaps. I know what they are, but you just relax, you slow things down. It's like anything else. You just answer the question, stick to the question, don't elaborate. It's easy. And so it
no,
won't be
but
an issue for case managers.
workers' comp can be a litigious area,
Hmm.
because, you have a lot of people, a lot of hands in the pie here. But as I think both Dr. Ralph and Jane Ann said, documentation is important. So document well what you did, and then you stand on that. You understand your role, you understand your boundaries, and you document. So you don't have to fear that. Lori, why don't you tell the audience about some of the programs that you have to help prepare a nurse look at this? to get ready to pivot from if they want to leave from a bedside area to workers'
Sure.
comp?
Sure. So we do offer a workers' comp case management three-part program. One is foundational, and that is a self-paced course, and that's to bring you more information of these terms that we're talking about, digging a little deeper into understanding how it all fits together, what your role is, and it's the big picture in workers' comp. Then we have a second part, which is the coaching and mentorship program, and that's I do that course, and that is a one-on-one, very flexible courses where I actually walk you through. I take a scenario, and through 8 weeks, we walk through the case and we talk about the ifs and whens and what to do at what point, and bring in all the information that you learn in the self-paced course and apply it to a case scenario. And then you move on for an internship with Chelsea. And Chelsea does some more hands-on real world experience where you're actually handling those cases. And I think that it's the three-part program is very effective because it gives you a well-rounded experiences and education in order to be able to um, proactively and confidently go after those workers' comp jobs, because you are getting the experiences, even though you haven't actually been hired and worked for another company. You have gotten the experiences, the background, and also when the employer is looking at you, as Chelsea and Anna both said, they're looking at more than just that. They're looking at what are those translatable skills that you carry, and how would they be a good fit? Ahmed, Janine, as we've talked about, I've talked to both Janine and Victoria about workers' comp case management, and Ahmed is that's how I got my start in case management and workers' comp. I started in Ahmed. So right off the bat, you have a really good background and understanding. But that's not to say, Victoria, with your background, being a travel nurse is shows a lot because you have to jump in, you have to think on your feet, you have to be flexible. And also, what you're doing right now as a new nurse, not new comparatively speaking, you have experience, but what you're doing right now by putting yourself out there on LinkedIn and reaching out to connect with other nurses. And she has an interest in legal nurse consulting as well. And I was telling her that nurses and workers' comp, you get that exposure to medical record reviews and how to write a cover letter and how to do all those things. So I say stack your skills, stack your jobs. It'll lead to the next best job and perhaps the best pivot you've ever done into workers' comp. So, talking about what you've done in travel, your interest in legal nurse consulting, the interest in just keeping your mind open to opportunities that can come your way. I think that both you and Janine have excellent skills. I hope this was helpful for both of you all. Marianne, I know thank you for joining us. I really appreciate that. And I don't know, Anne, can we open it up to see if they have any questions at
Yeah.
this point?
Yes, if anyone has any
Sure.
questions. One thing I did want to say, there's a lot of job opportunities out there for nurses who want to go into workers' comp. A lot of big companies, Gen X, Carvel, Marriott, all the different, think of every employer has employees of a certain number of employees. They have to have workers' comp insurance and somebody manages that. So there is a great, opportunity if you're interested. Anyone would like to have anything to say? Marianne?
No, I was just going to say to the ones that are looking into becoming a workers' comp nurse, I think you're going to find it beyond rewarding, but also just realize that, yeah, it's a large community of nurses that are out there, and somebody's always, put it out there, whether it's in LinkedIn or questions or, these case management groups, and
Mhm.
just say, hey, lot of people ask a lot of questions, you know? So expand your own skill set out there and see maybe somebody's going to pick you up. You never know with what your own background is. So don't limit yourself. The sky's the limit, as far as it goes. And and you'll be able to carry this with you for as long as you want to stay in nursing.
Jane Ann, want to add anything? Closing comments?
She just asked a
Um,
question, I think.
you mentioned the big companies having a need for case management, due to the number of employees. Would they, would a case manager position there in a company be able to be unbiased, like a patient advocate position? I mean, would you be able to really navigate what's best for the patient, or would you have a heavy company? I suppose that's
Anna,
very company specific.
I'll let Anna and Chelsea address that.
I'm gonna take that one because when I first started at Marriott, I had that like, where does my where does my loyalty lie? And how am I not being uh honestly, at least Marriott's motto is if you treat your employees right, they will treat our customers right and we'll get business again. So I have found it to be very easy as long as it's truthful, honest, and forthcoming. The patient is. We have occupational health nurses that work in the hotel, and also they do their own case management. We have like 4 in Florida, 1 in Maryland. They're scattered all over the country. There's about 10. There used to be more, but now there's about 10. And they do hands-on like OC health, and they do education, and they do case management. But when it becomes litigated, the OC health steps out. She no longer does case management because that role is conflicting because you are the employer. Now the telephonic case manager is not. They're sort of like for the whole company, so it's not conflicting. Now we don't allow our telephonic case managers to talk to plaintiff attorneys. If they would need to speak to us, they need to speak to us through either defense counsel or the adjusters, but not directly with us. So that's what I can tell you. And I can't imagine practicing case management without the patient being the center. So our focus is always patient first, and then all the little things around it we deal with.
Yeah.
But we are always patient first.
I'll say that's the same. We did a talk at there's a large conference in Florida every year, and we did a talk on that, and it was all about integrity and how we manage claims with integrity, right? And one of my friends is he's over in insurance, a very large insurance company called Berkeley. So he wouldn't mind. It's out there. Like he writes on it all the time about integrity. And he said, we want to pay for everything that's ours. We want to pay for it, right? As long as it's ours, we want to pay for it. And even some things that aren't, we will. If we make that determination, we'll go pay for it, right? And we believe as long as we're doing that, as long, but we have to manage our clients' money the way that we're supposed to. And so we actually did a faith-based talk with like integrity and all that sort of thing. And so I wish you could have heard it because it was a really great dynamic on like how do we it did have a faith-based component to it, but it was all about how do we manage claims with integrity, right? Like what are those core principles? And at the end of the day, it all just comes down to like being a good steward of our resources, our gifts, and everyone around us, all of the finances that are entrusted to us, right? As long as we're doing that, then we don't have to, as long as we don't have to question our motives, right? Everything else will fall into place.
Right.
Yeah.
Lori?
I was saying always focus first and foremost on the client, on the patient. Remember your role and remember what your goals are is to help get the patient. You'll hear this term maximum medical improvement back to their pre-morbid condition. If you always keep your eye on the prize for the patient, that's what I always say, getting them back to full duty work, the work they were doing before. If that's not possible, how can you help them in a different role to keep them working? If you keep that out front, as Chelsea says, it's all about integrity and also understanding and really understanding what your role is. You have to be very confident in learning and understanding what your role is as a case manager. I think that's big.
Dr. Ralph, I'll go to you and then we'll close with Victoria if she has any questions. You're muted, Dr. Ralph.
Okay. I think it's really important that somebody who goes into this understand that they're just not they're actually like function as a translator for their client. They are there to be an advocate. It is if you advocate for the injured person, you won't pick a side.
Right.
And what you do find in a lot of these cases, and talking to attorneys on both sides, they insurance companies know they're going to have to spend the money. They can't keep it all in the bank. Okay, they want to spend it to the people on the people who have the injury. They want to know what cases they should adjudicate and what cases they should settle. Their workload is tremendous. They just want to do the right thing as many times as they possibly can. And that's where you have a wonderful opportunity. You have a wonderful opportunity for your client sitting in front of you to be sure that the right thing is being done. And you can still be an advocate. You're not going to lose your job if you speak, if you say somebody's doing something wrong. That's not what's going to happen to you.
Yeah.
You're going to be recognized as being somebody who is truly passionate about what you do. And I don't think you get into this unless you can be passionate about it.
I agree. And I think that's part of why we felt strongly to bring this to nurses out there who are maybe working, they might be case managers, generalist case managers, working in managed care companies or on the floors in hospitals. You really get to do case management. You help to manage a care coordination, transition of care. As Anna said, there's spinal cord patients who their whole lives were just upended because of their injury. It changes everything. But by giving them the resources they need, people really do well. They're very resilient. So your passion, your commitment, and just your, ability to critically think, I think serves you well as a nurse. So Victoria, how did we answer your questions? Do you have a good sense of what workers' comp is and anything you'd like to ask us or comment?
Yeah, I think that you guys have covered all the potential questions I could have. Um, I, yeah, I am a travel nurse and I do see case managers and social workers, but of course that's in a hospital setting. So I really didn't know how a case manager would be able to be beneficial in a workers' comp situation or just really in any situation. So, yeah, this has given me a really great insight of what that entails. And yeah, like what Lori was saying earlier, I am wanting to explore other jobs other than working at the bedside. So I'm very open just to, learn and just to see what else is out there. So I appreciate it.
Well, as they say, there are no limits. So have fun,
Mhm.
enjoy it, use your skills, and thank you. Laura, you want to close us out?
No, I just want to say thank you for attending and for the people out there. Hopefully, this is going to be is being recorded, so hopefully we'll reach a lot more nurses out there that have a curiosity for what workers' comp case management is, and it'll be up on the website, and so it'll be out there for other people too. Thank you all.
Oh,
Thank you for the panelists.
one thing I wanted to mention at the CMSA conference this year, it's going to be in Las Vegas. If anyone is a case manager, CMSA has an annual conference every year. And Marianne and I and two other panelists are going to be talking about workers' comp at the conference too. So if you want to learn more, that's a great place to learn at the CMSA conference and to network with your peers to find out what job opportunities are out there and just have fun and celebrate what we do because we are making a difference. So thank you all for coming. Thanks to our panelists who really provided some good information. Thanks to Lori for supporting nurses and building. I put the Stepping Stones Nurse Academy link up on the website. So take a look at it, browse it. A lot of good opportunities for you to use your skills and grow.
Thank you all. Thank you all for coming.
Okay, good night, everybody.
Good night, everyone.
Thank
Thank
you.